Option Care supports the nutrition needs of thousands of people every day. Sometimes a medical condition can make it so that eating and drinking aren't enough to provide the nutrition you need. When this happens, your healthcare provider may decide to give you additional nutrition support. For many patients of all ages, Option Care is the first choice of this type of care. After all, we've been providing enteral nutrition support in the home for more than 30 years. Option Care is different because we use a multidisciplinary approach to care. This means we provide a staff of registered dietitians, nurses, pharmacists, and enteral coordinators who are experienced in providing enteral nutrition in the home setting. Providing quality care and services is our primary goal. We are available to answer your questions 24 hours a day, 7 days a week. Welcome to Option Care's Tube Feeding by Bolus Syringe Method instructional video. The following steps will help you administer your tube feeding effectively, comfortably, and safely. First, gather your supplies and place them on a clean work surface. For your tube feeding, you will need cans or cartons of formula. Store unopened containers of formula at room temperature and in a dry location. Shake can well before opening. Clean the top of the can with a damp cloth. Once a can is opened, use immediately. Store any unused portion covered in the refrigerator for no more than 24 hours, or as directed on the can carton. Syringes. Clean with warm soapy water and air dry on a paper towel between uses. Cup of lukewarm tap water. Always make sure to wash your hands thoroughly with soap and water, rubbing for at least 20 seconds before beginning the tube feeding process. Ensure that you are sitting or standing in an upright position, or elevate the head of your bed at least 30 to 45 degrees during and after your feeding. Place a towel in your lap in case contents spill or your formula drips during administration. If your feeding tube has a clamp, make sure it is in closed position before opening the end of your feeding tube. If there is not a clamp present, pinch the tube with your fingers to prevent leakage when opening. Now you're prepared to administer. When you have gathered your supplies, washed your hands, and are prepared to administer the tube feeding, please follow these steps for tube feeding by Bolus Syringe Method. If instructed by your treatment team, flush your tube with water as directed prior to feeding administration. There are two different methods by which you may feed yourself with a syringe: gravity by syringe method or bolus by syringe method. First, we will cover gravity by syringe method. To begin administering your tube feeding by gravity by syringe method, remove the plunger from the back of the syringe. Then attach the syringe directly to your feeding tube. Pour the desired amount of formula into the open end of the syringe, allowing it to flow freely until the feeding is complete. You may control how quickly the formula drips by raising or lowering the syringe. It should take 15 to 30 minutes to administer 1 can of formula. Once the feeding is complete, flush your tube with water as directed. To begin administering your tube feeding by bolus by syringe method, pour the desired amount of formula into a clean container. Draw up the feeding with the syringe by slowly pulling out the syringe plunger, and then plunge slowly into your feeding tube. Repeat until the feeding is complete. It should take 15 to 30 minutes to administer 1 can of formula. Once the feeding is complete, disconnect the feeding set and flush your tube as directed. Here are a few tips to remember. To ensure you are administering your tube feeding effectively, gather all supplies necessary before you begin your feeding. Wash your hands thoroughly with soap and water before each feeding. Drape an old towel across your lap in case of spillage during feeding. Sit in an upright position or elevate your head by at least 30 degrees during feeding administration. Make sure to properly flush your tube at a minimum after each feeding. If not directed to do so by your treatment team, please contact your Option Care representative for flushing instructions. Thank you for watching this instructional video. You have now successfully completed the process of administering your tube feeding by Bolus syringe method. If you wish to learn how to administer your tube feeding by pump or gravity bag method, Option Care offers those videos as well. With each administration of tube feeding, you will get more comfortable with the supplies and the steps. Please call your healthcare provider at any sign of infection, skin problems, tube displacement, or intolerance symptoms such as nausea, vomiting, diarrhea, or constipation. For any questions or concerns you might have, please contact our highly trained specialty nurses who will help you understand the basics of home infusion therapy and will answer any question.